We have with us Dr. Omar Aftab, who's waiting very patiently since quite a long time. Dr. Omar, thank you very much to have joined us. Dr. Omar, the Pink Ribbon campaign that began in 1992 and now, of course, you spearhead this since the last decades in Pakistan as well. How important has this campaign been since you began it? What are the success stories that you have brought forward under your Pink Ribbon campaign as well? And how does the whole process of financing, of taking care, of managing as such an important campaign goes through?
Thank you very much. It has been a very difficult journey all of these years. Now it's been 22 years we are running this campaign in Pakistan, and we started from a point where talking about this bird bee was not possible at any level, while either it was on television channels, on radio, or going into community. So at every level, it was almost impossible to talk about this issue. On the other hand, Pakistan has the highest rate of breast cancer in all of Asia. More than 10 million women are at risk of breast cancer in Pakistan. More than 50,000 deaths every year with breast cancer in Pakistan. So how can we address such a big disease if we can't talk about it? So the biggest challenge for us was for many years to talk about this issue, to highlight the importance of this issue, to engage with the stakeholders, to engage with the government at different level, because the magnitude of this issue is so big that we need to have a multi-stakeholder approach for this. So, but still, we have come to a point where we have started talking about it. Yes, generally now people would know about pink ribbon. They know that there is something like breast cancer. But when this year, during our October campaign, we did a survey to see that how many women they practice early detection, how many women they go for mammograms for prevention. And you will be surprised that still, unfortunately, it's hardly 2 to 3%. And that's why 70% of women, they still report at third stage or even fourth stage with this disease. So we need to, work more on the behavior change. Unfortunately, we haven't been able to, despite of running these campaigns again and again every year for a month, we haven't been able to bring that change. And the reason, one of the reasons is that we being a patriarchal society and talking about women issues, and then especially those issues which include women's sexuality, that becomes very challenging. So we still see that, there are three stages of denial we see amongst the patients. First of all, if there is a symptom, they would deny, they would not go to a doctor for checkup. Then if they go to a doctor and if they are being diagnosed, then there is the second stage of denial, that either they would not tell their family or they would not go for the treatment. We need to really focus on, and this is the only cancer, in fact, the reason of running this campaign again and again every year is that this is the only cancer which can be diagnosed at the early stage. And if it's diagnosed at early stage, chances of survival are more than 95%. But still, I think we need to do more to, reach out to women, to motivate women, to get themselves checked, to go for self-examination, to go for clinical.
Dr. Omar, I agree with you that much more needs to be done, and by the statistics that you are mentioning, a lot more needs to be done, with starting with awareness amongst the women and the initiative amongst the women to go forward and not only understand what breast cancer is and how you can detect it at an early stage, so that you can also be treated at the right time. Thank you very much, Dr. Omar Aftab. Thank you very much, Dr. Hira Asim, to have joined us. We're a bit short of time, or else we would have continued to talk about it. This brings us to the end of today's show. We'll see you inshallah tomorrow with new story segments that pertain to us, you and Pakistan. Stay safe. Allah Hafiz.